hardening of the heart. So Wayne, why discuss this topic?
Well, we got some obvious reasons and some subtle, and they're subtle and distressing reasons, I think. Jason, there you are. The obvious reason is that as stress goes up, I mean, we all know that what we want to do is be heroes. We want to join hands and create safe spaces for the people we're dealing with at this unprecedentedly difficult time, and at the same time try to be safe spaces for each other, because we're all going through difficult times, and our loved ones, all of whom are going through difficult times. But the obvious reason for our topic today about compassion fatigue and renewal is that as stress goes up, we become more self-focused. It's just a function of human nature that stress goes up and caring connection goes down. Think about it. If you have a headache, you have a backache, you feel nauseated, you narrow your range of focus to try to get through this hard time. If you've got the flu, and then you expand your focus and respond with more concern and caring, and notice the tone in the voice or the tear in the eye of the other person. Well, we're going through more prolonged distress than ever in our lifetime. Not since World War II have we had this much unrelenting turning us topsy-turvy in our culture. And God knows that's true in healthcare. Now, the more subtle reason is that you as a neuroscientist can speak to this better than I can. Let me throw it back to you, Jason. What are the long-term brain effects on your brain of unrelenting trauma and stress? I mean, I think that's part of what we're dealing with, right?
Right. I mean, ultimately, in basic terms, it changes your fight or flight response. You know, your central, cortisol pathways, and that increases cortisol levels and adrenal outflow. You know, that whole fight or flight system is just amplified and thrown out of whack.
And what does it do to dopamine?
Dopamine can also be affected, increased.
Well, it doesn't prolonged stress diminish dopamine effectiveness in frontal cortex. This is, I'm a layman, and Jason is a physician, but from a neuropsychological standpoint, what I've understood is that the problem with prolonged unrelenting stress is it affects your amygdala and affects your prefrontal cortex, so that people who live through prolonged trauma end up having less self-regulation. And therefore, it increases not just self-focus, but also maladaptive coping.
Right.
Because of what happens to brain chemistry. And it shows up in different ways, right? The signs show up in different ways.
Right.
And, one of those is we can't treat something we can't diagnose. So we may be splitting hairs here, but we've got now we're going to get to some solutions, guys. This is not all about let's shine a light on every which way how we're suffering. But we talked about burnout a bunch, which is when our coping energies deplete and don't rejuvenate. And if you add, in some ways, compassion fatigue is a combination of burnout and secondary trauma, the exposure to trauma. And we're hearing from around the country, painful tales of we're trying to, in this series, call to all of us, don't just isolate. Look, these are hard times, and I wish we had 500 people tuning in to hear these messages. We're all in this together. What we know is that when health professionals, this is from Medscape survey, it had over 8,000 responses before COVID hit. And when healthcare providers, physicians, and advanced care practitioners get distressed, either depressed or burned out, and when we're asked, how do you cope? 48% said, I isolate myself from other people. And so we're going through these traumatizing times that perpetuate at least some degree of burnout. We are big-hearted people. That's who goes into healthcare. It's the good boys, the good girls of the world. We grow up and we want to go help people. And then we're faced with really difficult stuff. And oftentimes are trained to just be tough and keep on going. That's how you to compartmentalize, to not let ourselves become overly emotional. Now that creates the experience for so many health professionals we have coached and counseled over the years. Um, my daughters Rebecca and Judy were talking about this the other day. How many health professionals are dealing with now in doing remote coaching? It's like dealing with people who emotionally someone's got their foot on the accelerator and the brakes at the same time. They're filled with empathy. They can feel and understand the pain of this family, or these colleagues who are so worried about their children doing some remote learning, or they're worried about their own financial future. And then they're compelled not just by empathy but by compassion, which is I don't just feel a response to people, but I respond to people. I take action. Now, if we go through a week of that and have some time off to recover, I just described what most of our lifestyles have been who've been working in healthcare for any length of time. But these times we're filled with empathy, we're filled with compassion, and it's wearing us down. And if we don't have the right mental map about this, to think that, and I'm speaking to each of you, to think that you can get through this without some degree of psychosocial distress is distorted thinking. I know you're strong and I know you're tough, but I'll invoke the wise words of physician Rachel Naomi Raymond, beautiful person, beautiful poet. She's retired now. And first, I was a foundation that supported her coming to Pinehurst years ago. But she said something profound. She said this, Rachel said, the expectation that we can be immersed in suffering and loss daily and not be touched by it is as unrealistic as being able to walk through water and not get wet. And so, of course, we're experiencing some degree of compassion fatigue. By definition, what happens is when we start developing a chronic state of tension and preoccupation with the suffering of those people we have helped, and that preoccupation and that wear down starts affecting the helper. Increases odds, then we're going to have some burnout. It also increases the odds when you have secondary trauma. Now, secondary trauma, by definition, is what happens. Now, one way to think about compassion fatigue, we can talk about how this develops so that you can recognize the building blocks and do something about them. But compassion fatigue develops over time. Secondary traumatic reaction, and you correct me from a psychiatric standpoint if I'm erroneous here.
I was going to ask you, so compassion fatigue is often synonymous with secondary PTSD. And so, yeah. And you've talked a lot about secondary PTSD, where somebody, through hearing about traumatic stories repeatedly over time, becomes traumatized. But what about the primary fatigue that goes on, within the hospital with directly observing a lot of these traumatic experiences that go along with COVID? How does that come into play?
Well, that's a fascinating time. Yeah, as always, Jason, I know we're kindred spirits in this. When you understand the delicate balance we live in at best, whether it's neurochemically, in all that controls in terms of thinking process and emotions and moods, or the delicate homeostasis and balance we live in. We work so hard, we care so much, we juggle so many. It's a wonder all of us our heads don't explode regularly. I mean, it's all like, with all due respect, as I look at my daughters and nieces and wife and how all of you don't go crazy just based on all the hormone stuff that happens being a woman. What's remarkable to me is how resilient people are, is my point. It's not remarkable to me that people get symptomatic. It's remarkable when people don't get symptomatic. So to your point, all over the country, I am talking with people who have gone through, I mean, it's just unbelievable stuff. Why do some people develop secondary traumatic stress reaction or compassion fatigue or burnout is always explainable. What is a puzzle is why some people don't.
Right.
And so we are not saying that everybody's on the way to being screwed up. We're not saying everybody's going to come apart at the seams, even though what I said earlier, if you think this doesn't affect you, I'm encouraging you to think again. I'm not saying you're going to get symptomatic enough to get diagnosed, but be aware that we're all imperfectly human. And when you put human beings in extraordinary circumstances, no matter how caring you are, and in fact, the more caring you are, the more vulnerable you are to some of this wear down. Now, I just find it rather than splitting hairs about it, I know you and I aren't splitting hairs about it, Jason, but in the literature, sometimes it makes me nuts that people are, doing that. When in the real life journeys of very real people we deal with, it's just as useful to think in terms of, look, you're on a journey that's going to have some wear and tear effects. Now, some things supercharge distress. And that's how I think about secondary trauma exposure. If I go through a particularly horrendous experience, I've got to watch someone in the ICU die isolated from their family. I have to keep telling that family. Then technically that's what that kind of secondary traumatic stress reaction is. And then what people start experiencing is preoccupation with intrusive recall of those sounds and sights, and also oftentimes a paralysis that leads to fear. I've worked with neurosurgeons a bunch over the years, and just and we could say the same thing for other specialties, but I started being fearful of my children going outside, that they may get a head injury or a spinal cord injury. And so the suffering of the people we're helping starts to intrude into my own lifestyle. We lose boundaries. And in my experience, the secondary traumatic symptoms come on all of a sudden. It's like I was bopping along doing pretty well, floating in and out of being tired or whatever. But then all of a sudden I found myself stuck with this intrusiveness. Now, the compassion fatigue kind of goes through a predictable stage. And this is where the cautionary tale here is. We start off being zealots. It's rock and roll time. I am gonna, in fact, we have these invisible badges of pride that we wear. I worked a double shift, or I hadn't slept in 36 hours, or, I covered for my friends, or I've been in this hospital since last Friday. And we're proud of that in some ways. But if we don't take care of the machinery, mind, body, spiritual, relationship machinery, then we start getting grouchy, to say the least. And particularly are prone to, given how much I'm suffering, I am justified because I've over-sacrificed, I'm justified in overindulging, including biting your head off because you weren't here 3 days in a row like I was. And this is where it starts getting damaging, where now we've lost empathy and we're not acting compassionately.
Right.
That in fact, we start resenting the very people we're trying to help, either our patients, their family members, our colleagues. And that's one of the great sources of moral distress for people. Topic of a whole other discussion, perhaps, which is moral distress. But it is one thing to have moral distress because I feel like my organization is not resourcing me enough to take adequate care of missions. That's the most frequent, or they're working with that. But a real subtle form and pervasive form of moral distress is the judgments we feel toward families who are not doing the stuff we believe they need to do to adequately care for the person that we're caring for. So we go from being a zealot, we wear ourselves down because we don't appropriately manage the mind, body, spirit machinery. Right. Then we start getting irritable, and then we get into this, then we start withdrawing. It's sort of like, I'm going to show up, but I'm not going to be really engaged. Now, I hearken back to something I've talked about repeatedly. You can't swim half in and half out of the lake. If you're ambivalent about where you are, that's how you drown. Now that this happened, I'm going to start holding back. Well, if you hold back, you're not going to enjoy what you're doing. You're not going to re-energize. We've talked in the past, you got to manage energy, attitude, and relationships. The only way to get that energy flowing is to be engaged. I'm looking at your backdrop of sports arena. Nobody wins a game being half there and half out. Nobody goes through a hard time in marriage and comes out. Nobody heals a friendship. Nobody gets through time. You can work half time in a job you're not fully engaged in. It's going to solve none of your work life issues. One of my mantras. So we go from being a zealot to being irritable, and then we withdraw and pout because other people aren't living up to our standards. And then we get into this zombie state, compassion fatigue, where I'm like a walking set of symptoms of worry, anxiety, sleep problems, kind of hypervigilance, cynicism. If you throw in secondary trauma, some intrusive thoughts, in a sense of hopelessness, in resentment. What happens is we lose our elasticity. Some people have said burnout is you lose your ability to bounce back. And remember, our definition of resilience is you get through hard times and come out stronger. But with compassion fatigue and secondary trauma, we're taking home rather than taking a break from the stuff we're dealing with at work. And it affects not only our compassionate connection at work, but it also affects our effectiveness and it affects our self-care.
So this isn't something that develops abruptly, but over time, and oftentimes we don't see our own stuff. So how do we do a self-check from time to time?
That's a great question. So consider these questions. This is from a published kind of self-checks about self-compassion. How many of these would you say yes to? My colleagues seem to lack understanding. I find even small changes enormously draining. My patient's stress affects me deeply. I've lost my sense of purpose and hopefulness. I feel vulnerable much of the time. I feel overwhelmed by unfinished personal distress. And if, you add to that the rapid onset of, and then there was a particularly awful thing I witnessed. And I'm having startle responses, or it's difficult to separate my personal life from my professional life. I feel on edge because of what I experienced at work. I'm on edge even when I'm not at work. I'm experiencing and re-experiencing the trauma of someone I helped at work. I find myself avoiding certain situations. I have intrusive, frightening thoughts. If you got any of that stuff, please call Center for Professional Provider Wellbeing. I mean, that's why we're there, right? Or access some of the resources Dr. Jerry is going to talk about. That doesn't mean you screwed up. It just means you're a human being doing heroic work, and it takes a toll on us. So we gotta manage ourselves. Once we recognize it, we got to think about what we can do to deal with it.
So I think you kind of alluded to it there. With talking about how compassion fatigue seems to develop slowly, but then sort of that supercharger event, an abrupt traumatic stress can kind of really kick things into high gear.
And I've always been fascinated by that phenomenon. Jason, on both ends of the kind, you and I have talked about this in reference to recovery issues. It's like people live in a delicate balance, and just a little bit more or less of stuff of certain kinds makes a big difference. So I'm bobbing along and I'm used to taking call with this frequency, and we figure out, but then I got to take just a little bit of extra call, and it just is like falling off the cliff.
Right.
Or I have just a couple of free slots in the day, a little bit less, and I feel so much more energized. Or I have just a few little uplifts, unexpected uplifts, because I've talked about countering daily households uplifts, and it makes such a difference. So it's fascinating to me how much little changes make big differences, it seems to be the case. Similarly, in the journey of getting better, so one mystery for me is why now? And I always ask folks who come to us for help, why did you come in now as opposed to 3 months ago, 6 months ago, 5 years ago? And very frequently, unless they say, well, I was mandated to come see you and I didn't want to come see you.
Right.
Or my wife made me come. Sometimes there's a clear reason why she's going to leave me if I didn't come and I had to go. I had to take it serious. But usually it's not that. Usually it's, I don't know, I just got ready. I don't know why, but I came now. And we've talked about this in terms of recovery. People make a lot of starts and then they fall off and they start again and fall off, start again, the journey toward getting better. But then one day it sticks. One day they decide, we got research on this from various cohorts. When you look at smoking cessation, the vast majority of people who stop smoking don't go to any program. They just put the cigarettes down one day and say, I'm not going to do that anymore. And they don't. Now, that wasn't the first time they did it. Usually it's the 10th or 15th time, but it worked that time. They progressed through the stages of denial to preparation to taking action in so forth. We talked about that in prior times. So why does all of a sudden it kick in that, oh, I'm symptomatic enough now, I'm realizing I need to take good care of myself? We're encouraging you, if you're there, have hope. There are things you can do. And it ain't rocket science. It's common sense, not commonly practiced, though. Just like if you were going through recovery from anything, it would be, we got to drop back to remember, I've talked in every one of these sessions, I reference the resilience paradox, because I don't want us to sound like we are trivializing. Quite the contrary. There has never been a more complex time in which to lead, in which to care, in which we are called to cope than right now. But the more complex the circumstance get, the more you got to pay attention to the fundamentals of mind, body, spirit, and relationship. I hate to beat sports medicine first to death, but great coaches always say, just stay in your lane. No matter how complicated the game gets, you do your role, and your role is all you can do. Well, for us, that's taking care of our mind, body, spirit, and relationship. So number one, be aware of the risks. Number two, think about this accurately. The fact that you're going through some combination of whatever you want to call it, not feeling well as usual, whether we call it compassion fatigue or secondary traumatic stress syndrome or burnout or moral, whatever it is. Number one, it doesn't mean you're weak. It means you are a caring person. The only people, and this, again, I defer to you as a psychiatrist, Jason, but I would say the only people who are not going through at least episodes of psychosocial distress these days are absolute psychopaths. They're the I don't care what's happening around me, and so the fact that you're having some of these symptoms doesn't mean you're a weak person. It means you're a caring person. It is not a character flaw. You judge your character based on what happens next, and answer the question, okay, when I really think about my chosen self, my authentic self, what kind of man or woman do I choose to be? What kind of health professional what kind of leader do I choose to be? What kind of family member then the question is, what does a person like me do in a circumstance like this? That's the question. It's not what Dr. Jerry wants you to do. It's not what your spouse or what you get. What does a person like me choose to do in a circumstance like this? And in this instance, this is this person that I am. I'm vulnerable and I'm going through a hard time. So let me recognize that it's not a sign of failure, but that the risk, some of the risk factors that come with being a caring, compassionate, empathic person are these syndromes you and I are talking about today. And so the journey toward bolstering my resilience and rebolstering it and continue to bolster it starts there. And the journey toward recovery, if I've waited too long or if I've fallen off the cliff seemingly abruptly, starts there also.
So what about, I mean, you're talking about highly compassionate people. How do you keep from becoming that sociopath? I mean, not in the true sense of the word, but how do you keep your heart from hardening?
Yeah, that's that's the million. So I love this concept. That's $1 million question. I love this concept, Jason. The flip side of because it speaks to resilience, the concept of compassion satisfaction. And that's, it's sort of like is the concept of the good enough parent. When that book 100 years ago came out, dispelling the myth of the super parent, saying, you're never going to achieve that myth. Incidentally, I'm thinking about that because of the resurgence of concern, particularly about women. That the good enough parent. We're going to get back to compassion and satisfaction, but the good enough parent came about as a backlash. The concept came about as a backlash to the ridiculousness that a lot of us perpetuated. I'm not talking about Jason, you're not old enough, but myself, about the mythical balanced life. And all we did was set up everybody to feel guilty. And then sensible people said, well, for God's sake, we need to change the yardsticks people are using. And there, the super mom who was torturing herself to death needed some help with the concept of the good enough parent. And if you stop trying to be perfect, you will relax into your role and be a better parent. It applies to men parents as well as women parents. But this day and time, the recent statistics are alcohol consumption for women since last March has increased 46%, while for men has increased 14%. Right. Besides the jokes we can make about that, which is, guess what? We're driving the women in our lives crazy. Why aren't men drinking more? Well, you got women, we're doing everything for you, you knucklehead. That's why you're not drinking more. Then, no, don't anybody write me any emails. I'm compassionate for men too. I truly am. But that is a disturbing statistic. And it's related. So we get back to the good enough parent, or compassion satisfaction is what we have to go through. We need to reframe this. All right, look, it's a long journey. My career is not just this chapter of getting through from last March to this March, the first wave of COVID, but the continued creation of our unfolding normal will continue to change in ways that are unpredictable. So the journey is not over, and it's not going to be over. It's, this is it. And we talk about the psychology of incorporation. My life's about a lot of things. My career in medicine is about a lot of things, most of them wonderful. And I'm dealing with this too now. I'm dealing with learning to do epic. I'm dealing with learning to modify my roles because we have to flexible. Well, I'm also dealing with, and we're calling attention to this. We're dealing with, I need to keep an eye on things like compassion fatigue and burnout and moral distress. Well, an antidote is compassion satisfaction. It's hard to be satisfied. Satisfaction is sort of a function of what you expect versus what you got. William James said that, the psychologist, philosopher. And so what's important to learn is to reframe that I do have influence. Part of the demoralization in compassion fatigue is I'm not able to influence enough people to my satisfaction. I can't take care of all of them. I can't get all of my colleagues to behave the way I want. Well, what's important is to frame it that I do have a lot of influence, and that's a different sort of compassion. It's sort of like call off the shelf that tool we talked about when we were talking about managing attitudes that drive resilience, realistic optimism. I need to acknowledge the challenge I face and not drift into cynical hostility that leads to me being a zombie in compassion fatigue terminology, but I also need not to have rose-colored glasses of unrealistic optimism. I acknowledge the challenges I face, but maintain an attitude of hope. I can't help everybody, but I can help some people to the best of my abilities today. And that's a really, really important reframe that does two things. It helps you create some boundaries. I can't, and let me say, guys, you have learned to do this reframing to allow you to feel good enough about the job you've done today so that you got some energy to continue to chase excellence tomorrow. You've learned to do that a lot of ways. Somewhere along the course of your education, you realize I can't learn everything there is to learn. And it made me anxious because when I was the smartest one in the class in 5th grade, I could get all my work done before everybody else, and it felt great. Well, the higher performing you get, the more the demands happen, and then you find yourself in nursing school, medical school, graduate school, getting an MBA. I can't learn it all. There's more material available with the internet. God knows it's just information glut that I used to pride myself in going to the library and getting every article that's ever been written on a given topic, and Xerox them all back in the day. It's like, oh my God, the rabbit holes are endless now. So we've learned to reframe in other arenas, and you can use that skill where you realize I can't save every patient's life. Sometimes patients die, and death is not always a tragedy. Failing to care as lovingly as you can for people until they die, if they die on your watch. Failing to care is a tragedy. So learning to reframe that compassion satisfaction is I did my best today, given what I had to work with, given the tools and given the colleagues and given the people I was dealing with. I did my best today. Is a reframe that gets you into the compassion satisfaction arena. Compassion satisfaction is also in large a function of perspective. We focus on magnifies. And when we're distressed, we naturally scan for what's wrong or what I can't do to eliminate all of my distress. So the pros on compassion fatigue, like Dr. Charles Figley, who invented the terminology, talks about a couple of things that I really like. He said, develop self-check awareness rituals that in my car as I'm driving to work, let me pay attention to how am I doing? Let me do a self-check, mind, body. What am I thinking? Body, how's my body? Do I need to breathe? Where's my energy? Am I preparing myself for to be a caring performer? I'm going to show up with an open mind and open heart.
So paying attention to symptoms.
Yeah, paying attention to symptoms and self-correcting. It's sort of like, again, I hate to keep it, if I were a concert pianist and I'm getting ready to perform, I need to make sure my fingers are feeling flexible, right, and make sure in my head I got it straight about how I want to play this piece. Or if I was a dancer, I'd make sure to stretch my legs before I started in. Well, I'm getting ready to go do something very, very difficult. I'm right, getting on the front lines in that office where or in that cafeteria line where I'm working, or in that OR. No matter what your role is, let me get my head in the game, and then and prepare myself to have a good day. Prepare myself to have a good day. And I wanted to make it sound trite. It's not all about the way you think is going to affect the way you feel, but it's a heck of a lot about the way I approach it.
Right.
The second, in terms of compassion fatigue, you don't want to take it home, is some detachment rituals. And as trite as this sounds, it really is helpful. This is from the mindfulness. It was kind of walking mindfulness literature. So if we look at the meta-analysis of physician burnout literature and what works to curb physician burnout, Colin West from Mayo Clinic did a great publication on this. One of the very few evidence-based in the peer-reviewed medical literature treatments that curbs physician burnout, applies to all of us, and it is mindfulness based meditation training. Now, that doesn't mean you got to go stand on your head for 20 minutes, but it means I developed some rituals to reset my stress. So every time I wash my hands, I think, okay, that I'm washing away, that task is done. I'm getting ready to enjoy the next task. Every time I walk from that room into the next room, it's a cue, reset my. And so I encourage people to do a bunch of those. When I get in the car to go to work, okay, it's a reset. When I stop at that stoplight, I used to do this one for years. I didn't call it that, but I would do this. When we lived in Winston-Salem, our office was maybe 10 blocks, 8 blocks from our house. And on the way to work every day, when I got to the intersection of Hawthorne Road and Millwood Street, which was right before the hill that went up to where our office was, I would ask myself the question, if I get to work and Kathy Hall was our the office manager who worked for us for 26 years. If I get to work and Kathy said to me today, I quit, I'm going to work with them over there, what would I beg Kathy to give me a second chance to do more or less of so she didn't leave? And then on my way home, when I hit that same stoplight coming the other way,
right,
down Hawthorne, I would ask myself the question, if I got home and Mary said to me, my wife, I don't love you anymore, I love that person, I'm leaving, what would I beg her to give me a second chance to do more or less of? That's a mindfulness kind of a thing. Right. So let me just stop my self-obsessed busyness that keeps me out of noticing. And what Charles Figley recommends is some awareness rituals, self-check before you enter the arena, and then some detachment rituals when you're to prevent compassion fatigue oozing into your personal life. I'm washing my hands and I'm closing the door to my office, and all the work remains there, and it needs for me to rejuvenate my energy so that I can come back and do a great job again. It's sort of like if we take a break from parenting our children and have date night, it's a good thing because it helps us to re-energize and tolerate all those screaming children.
Right.
So we need to think about the same thing when it comes to compassion. The way people end up on an endless downward spiral with compassion fatigue is, I care so much I can't stop caring, and I can't stop thinking, and I don't stop caring. And if I do stop caring for a moment, if I stop being preoccupied with everything, it means I don't care, and that means I'm a bad person. And all that stuff is what creates the downward spiral.
And so a lot of that is learning to be able to keep things in the moment rather than allowing your mind to wander into the future and get anxious, or allowing your mind to wander into the past and say, if I only would have done this or would have done that, getting depressed about a lot of those things.
It's a great point. And I think also reminding ourselves, if anybody could do this, everybody would. Coping adaptively with life is complicated because people are complicated, starting with me. And it's not just one thing or another. It's not either I care or I don't care. It's that I do care, and sometimes I need a break from engagement. I was talking to one of my sons-in-law about this the other day, and I mean, he's not a particularly philosophical guy, but he said every night one of our grandchildren was having 11-year-old granddaughter was having trouble sleeping, and he said, I told Macy, do what I do. Every night I try to tell myself, I put myself to sleep saying, the day is over. It's okay to go to sleep. I mean, as simple as that. It's very sweet. We need to be sweet and simple to ourselves. Look, I did the best I could given what I could do today. I'm proud of myself because I did as well as I did. There's no danger, and I've said this so many times, there's no danger in feeling good. It motivates us to keep doing good. And so we got to, in addition to being here and now focused in the ways you just described, Jason, which is a nice way of thinking about it, rituals that get me focused on, look, it's not the future, it's not the past. This is what I'm dealing with right now. And that's one of the characteristics of resilient people. They focus and execute. That
Right.
doesn't mean they always hit a home run. That doesn't mean they always get a standing ovation. That means they show up and are attentive to this child soccer game, or to this conversation I'm having with this patient's family, or to the tear in the eye of my colleague. I show up. I show up with awareness. But then we also have the right. What I'm alluding to also is not just execution strategies, but also having the right philosophies. That, yeah, you are going to have some fatigue, physical fatigue, emotional fatigue, compassion fatigue. That doesn't make you weak. It means you're a caring person. It's also important to remember the fundamentals. I talk about our ear for resilience. I harp on it because let's not forget it. We got to manage our energy, our attitudes, and our relationship. Support matters. Being able to debrief with each other, even virtually, just socially distance, physically distant. We need to be physically distanced, but stay socially connected. I love that concept that's buzzing around now these days. Because we need to have a connection with each other. There's no doubt about it, and offer support to each other.
So I'm curious, and we haven't talked about this, but Martin Seligman's 3 good things strategy.
Yeah.
They've done research on this, and if at the end of the day, when you're climbing into bed, you write down 3 positive things, 3 things that went well
Right.
through the day. And of course, the research has shown that if you do that straight for a couple of weeks, that 6 months down the line, it decreases your risk of burnout.
And
I'm wondering, does that apply here when you're talking about being exposed to negative outcomes constantly, things that go wrong? Does that sort of refocus? Is that helpful?
that's an interesting question. I don't know of any research that specifically has shown that 3 good things prevents or curbs compassion fatigue or secondary traumatic responses, but it sure as heck can't hurt, right?
Yeah.
And the research on that is dramatic. And guys, just to elaborate on what Dr. Jerry said, it takes 30 seconds to do it. So
Right.
the 3 good things, this is one that I practice, that I preach some in, that the 3 good things in my journal that I kind of keep informally anymore, but I did it formally for a while, would be things like, I told Mary a joke, one of my Cajun jokes, and she laughed and laughed, and it made me feel just loving connection with her, that we have the same sense of humor. I looked at a video of one of my grandchildren trying to say the word popsicle when he was 3, and he had a lisp, and it was just beyond precious. And I so admired him because he didn't give up, and then finally he got it, and he said it right, and he was so proud of himself, and it just made me feel joy. At the time, I was traveling a bunch, and I saw some idiot guy screaming at this gate agent because the plane was delayed, and the gate agent happened to be female. And after this narcissist went sit down, the next man, some man stood up, some brave man stood up and said loudly, "On behalf of all the other men sitting here, I want to apologize to you for how that man tried to bully you." And we all gave him a standing ovation. And it just gave me just a sense of pride that they're still good. So it took me 20 seconds to think, let me think back. Yeah, what are 3 good things? It's also, and so the research shows by day 5, if you commit to doing that for 7 days, by day 5, your mood lifts. And it's not magical. Why? It's
Right.
because you'll be trucking along in a lousy mood outside of awareness of the now of your life, to your point, Jason, and then think, oh God, I got to write in that stupid journal tonight. I better notice something good going on. And what we focus on magnifies. So you start noticing. So we always challenge people not to do it just for 7 days. Do it for 14 days and watch what happens.
Right.
Happiness goes up over 6 months. Depression goes down. I'm not saying that's to everything, but it helps. It
Right.
helps.
Okay. So I guess the one thing we haven't touched on is what can the organization do, not just the individual, but
Well, yeah, I this is a my let me just say my point here is not going to be to criticize First Health. That we've got to, as organizations, do the best we can to incorporate into the unfolding new normals, plural, because it's going to keep changing, more and more ending of the conspiracy of silence. So I think that whether we're talking about burnout or we're talking about satisfaction or whether we're talking about what kind of tangible help do you need, what kind of emotional support do you need, we need to continue to have more forums for dialogue where, incidentally, it's not just lead. I hear this all over the country. The Mickeys of the world will say, I have town hall meetings, but not everybody shows up. Well, you know what? This is what it takes. It takes two hands. It takes, I show up with an open mind and open heart, whether I'm an administrator person or I'm the people that are being administrated. We all show up and we try together to do the best that we can. So I think that we need, when it comes to compassion fatigue, we need to put matters of compassion fatigue on meeting agendas. We need, as administrators, to support forums that allow people to come together to talk about, even remotely, what they're going through. Things like Schwartz rounds, which allow people to gather and talk about moral distress they're experiencing. Or, and it's not a workshop, and it's not somebody telling you the 3 steps to get to heaven or anything else. It's as fellow warriors in this battle to do good in the world, we pause and come together and appreciate each other. But that requires institutional acknowledgement that we need it, and institutional resources to create it. We've also, we got to, as leaders, I think, change the dialogue from pay attention to what you're reinforcing. If people are momentarily, Kathy Hall, I've referenced, our magnificent office manager for decades. Finally, we had to talk to Kathy and say, Kathy, you working all the time is not doing us a favor. We want you to be here for decades. We need to change the meaning of, I don't want you to be the first car in, the last car out every day. Please, that won't please me. And so as leaders, ask yourself, do you truly support people taking better care of themselves? Do you resource them adequately? I mean, that's one thing. You want us, I can hear with the cynics who might view this program and say, you want me to be less fatigued? Give me more of me. Add 3 more people in our ICU, add 5 more people distributing these food trays, whatever it may be. And, it's not an either or, it's an and I need to take better care of myself. So leaders, to the best we can, need to be able to resource what people need, whether it's tangible help, information, a supportive emotional environment that allow people to do good, or a sense of community. Ideally, coaching from the perspective, we need to do some tag team, particularly now. We need to allow people to rotate off of the front lines best they can and not work the superstars into compassion fatigue, not work the superstars into we're going to use you until we wear you out. Another thing is sometimes small things make big differences. Now, I should have started this by saying, as I'm listening around the country doing these programs, what works and what doesn't, no one thing works for everybody. And no one thing in a given institution works all the time. So I may have referenced this one before in one of our sessions, forgive me, but I was talking to, I was doing a session like this in the hospital in Houston, and the hospital, the chaplains had the Soul Express. They had a cart that came around and had snacks and water and little fake flowers and affirmations. And they would just show up on a unit by way of saying, take a 1-minute break. Come and take a 1-minute break. Let us tell you how much we appreciate you and you're a hero. Well, They showed up outside the ICU, and 3 of the seasoned nurses came out and said, "Get that cart out of here. There's nothing on that cart that's going to help us where we're hurting today. We need more help."
Right.
Now, the point of that is not that the pastoral counselors were trivializing their stress. Later on, those same nurses called and said, "I'm sorry, we were just distressed. Please come back. We love it when you come. But we also do need some more help." Another place I was working with, I consult for Atrium in a wonderful CRNA I know there is started a peer-to-peer support program, and I kind of meet with her to talk about that stuff. They've created a kind of Zen, they call it the Zen room, and they got just some little repurposed closet or something, but people can, it's just a place to go where it's quiet and you can go in there for 2 minutes and regroup or say a prayer or do deep breathing or, do whatever it is you want to do to help yourself. But the purpose is when you enter here, please do something that re-energizes and polishes your soul and reminds you of the good work that you're doing. You've got people, signing up to get in there. So a lot of times it's little things that can make a difference. Leader rounding, coupled with in your leader rounding, asking questions, not just about what kinds of equipment you need, but making it part of the organizational dialogue. Want to know how you're doing emotionally, or that we noticed just looking at the statistics what was happening here and wanting to check on how you're doing. We hear from a lot of leaders. They're we don't know what we don't know. But when leaders start doing that, often they're shocked that, I'm talking about really good leaders saying, "I had no idea how hard it was on, Third West or in that ICU or in that pediatric unit until I visited and saw what people were going." And health professionals always say, "I wish the leaders would come here and see what it's like." I worked with a pharmacy once and said, "I wish they would come and just see." We fill 1,800 prescriptions, most of them faxed. This was just 15 years ago. We're still using fax machines, and we have the admixture unit, and we got it's like pandemonium in here. And all we hear is people complaining the drugs are not getting out. Or food services people say, "You try feeding this many people and see what it's like." So
Right.
leaders showing up and just expressing, inquiring, is there anything we can do, big or small, that would be helpful? I'm not Santa Claus, I can't deliver it all. But the fact that you add, remember one of my, in my EAR acronym, relationships, I said one of the is manage relationships. One of the questions you could ask regularly, pick some people at work and at home, say, "Hey, could you tell me just one thing I could do to make this a better day for you?" Just asking the question makes it a better day for most people. So I know we're wrapping, Jason, and I would just pose to folks, think of yourself as you were when you entered the profession. What were your ideals and aspirations? And then think about some of the surprises you've had along the way. Some of them good, but some of them shocking also.
Right.
And then the real work of preventing or curbing compassion fatigue is to treat yourself as you would right now if one of your younger loved ones was going in your profession. You would say, "Sweetie, no matter what, be sure to," and you would give them some philosophies, you would give them some heartfelt advice about caring for themselves. The real antidote to compassion fatigue, of course, in the preventative factor, is self-compassion, treating ourselves with the same kind of interest, kindness, and forgiveness that we give to other people. And we hope that these sessions will help you guys to do just that.
Excellent. Thank you, Wayne. We appreciate you as always.
Thank you, buddy.
Joining us and giving us some really sage advice.
It's always a pleasure to work with you. And First Health is lucky to have you, and lucky to have our center, and lucky to have the support of the foundation. It's always a privilege to work with you guys. Thank you.
Thanks.
Bye-bye.